Will Green, who's one of our innovation officers. So Will, would you like to come up and give feedback?
So that's going to be really annoying with the feedback of all the paper on this, isn't it? So I think there's going to be a lot of repetition today. So I'll try and break this into some quite broad areas. So we found that there is, in terms of biofilm prevention and biofilms more generally, there is a bit of a lack of linking up between terms that have got good cut through, like AMR and microbiome, with biofilms itself. So in order to drive more innovation and funding into biofilm prevention and our other interventional themes, kind of capitalizing on the success of some other terminology that's got through maybe more than biofilms, this is quite important. In terms of training and education, obviously from the ground root stuff that was spoken about yesterday with kind of early children in primary and secondary schools, but also at an undergraduate level with the levels of kind of biofilm. When you're talking about microbiology in university, you should be talking about biofilms, but there was, examples of people only come across it in their third year when they've taken an elective unit in biotech, and everything else before that was spoken about planktonic and things like that. So there's some work to be done there. And then I think the third piece I'll talk about that we found was quite important was kind of language that's used in marketing, and then specifically in journalism as well, in that there's more that we can do to kind of influence the language that's being used, and especially with the success of the chief medical officer and people like that being put in front of cameras, kind of what's reported on for biofilms and in terms of biofilm prevention as well is quite important. And at the moment you get, maybe it's only really sensationalist news stories, and I know every academic in the room that's had a newspaper article published about some of their research will know that it's not necessarily exactly what you did that ends up on the newspaper. So I think those are the three kind of broad areas that we were talking about. And then specifically for prevention, the same things came up in that there needs to be appropriate standards that are reproducible, that will allow people to make claims that will be the driver of innovation. So I think that's all from my group.
Thanks, Will. So the second table number 2 from the morning was Jonathan. Introduce Jonathan. Jonathan's based at the University of Liverpool and supports our team there, and he's going to feedback on team number 2 from the morning.
Thank you, Alexander. I suppose broadly, actually, a lot of the points, as will be the way, were sort of covered by Will. I think there was a massive sort of thing from my group this morning about education, but in a broad sense of not just standards, but sort of general behaviours, I guess, around sort of what biofilms are, how they sort of interact, and sort of both academic and sort of governmental attitudes towards them, I guess, in terms of helping people to understand this. Will's alluded to language there, sort of understand actually what the problems are and articulate them better than what we are doing currently. That sort of led into a sort of wider conversation about the dialogue between kind of industry and academia, which obviously NBIC's working on quite closely, but trying to make that maybe slightly more pliable. Then we discussed some stuff about sort of the differences, I guess, in terms of standards between kind of academic stuff and sort of industry, and maybe kind of formalising that. There was some good stuff on kind of sort of the different level of standards, I guess, in sort of academic approaches versus industrial approaches, and whether we can sort of work to kind of make those more even, so things that we do in labs at an academic level translate better and vice versa. Did have a really long conversation about sort of methods and protocols, which I think a lot of people have probably had today, around sort of standardising approaches, I guess, to what we're doing. So it sort of touches a little bit on the slide Rasmita showed this morning around how a lot of people aren't really describing the approaches that they're using when they're reporting on these things. They're just sort of alluding to the processes they've used, and there's not really been sort of a methodology, and there's sort of conversations around like some of these things are being done in dark situations or being done in light situations, how that affects sort of the growth and stuff. And there was also, I suppose, as a spin-off from that, a focus on sort of moving some of that work from sort of in vitro to in vivo situations. And often that we're sort of looking at more consistent techniques as a sort of a research base, rather than looking at the bigger picture. We're trying to just focus on what we can get the most consistent results out of, and that isn't always necessarily what will lead to the best solutions. That was it, I think. We'll cover a lot of stuff.
Thank you, Mark. Hand that back to Mark. Right, so common themes, starting to emerge, as I'm sure you're hearing. Table 3 in the morning was Miguel from University of Nottingham, one of our co-directors. Mark here is going to hand you your script, and you didn't do one this afternoon, so
I'll have this one. Right. We had a lot of discussion, and some of the points that we discussed, they've already been mentioned, so I'll try to mention especially things that are different. The first thing that we wanted to, that we think is important, is to differentiate between what is prevent in terms of colonization. So, for instance, when you're talking about wounds, it's very different whether you're talking about a marine environment. Because in the case of the marine environment, something that is going to be very important, for instance, is going to be the conditioning of the surface. So this is something that we really need to bear in mind. The other thing as well is that prevention sometimes of colonization, we're thinking all the time about abiotic surfaces, right? But sometimes what we may be considering as well is the actual microbiome that you've got there, that you may not want it to be colonized by, let's say, a particular pathogen. So one of the things as part of prevention may be maintaining the actual microbiome that you've got there. So it's a concept that you have to bear in mind. Then the other thing as well is when you have a particular treatment, it's very, very important to ensure that any interventions that you have are going to be able to maintain the performance for a long time. So it's no good to try to create a particular intervention that is going to work for a very short time, and then eventually you're going to get colonized again. So that's something very, very important. A lot of discussion, and that was from the morning and the afternoon, came with regards to the models that you're going to be using. So that has been described. And the one thing is, how far do you take that model? What conditions do you want to take? Because we may spend in all our lives, just trying to increase the complexity of these models, but we may not need to. So trying to get that compromise. Another point is, how do you know whether a particular intervention to prevent a biofilm has worked? What you're looking at, is it a real biofilm or is it not? The other thing, if you're focusing on health, there are many technologies that are being developed, but we have to make sure that they are biocompatible, right? Because sometimes you may be creating something that is not going to work. Another point that we discussed is the need to have more responsive surfaces to biofilm information, so that they can interrupt the biofilm, they can respond to the presence of the biofilm and interrupt that formation as the biofilm is forming. With regards to coatings, for instance, when you are creating those coatings, it's very, very important to ensure that they're not releasing or evolving in a way that are releasing toxic chemicals that may be causing an issue in the environment. We need a lot more knowledge on the fundamental biology. And especially one of the things that we need to look at is a single cell analysis in different environments, and then try to apply that across sectors. So we've got now technologies that have been developed that can actually do that. So probably we need to do that. We need to address also the heterogeneity of strains and the media that you're using. So try to get organisms that are living in the natural environment when we're doing or we are developing our interventions. That's very, very, very important. The other thing as well is perhaps we should be looking more at physical interventions. A lot of the interventions that we're looking at, they seem to be based on chemical interventions. And some physical interventions, probably they're not going to care that much about the relationship that you may have between the organisms. So you may be able to tackle them. Are there interventions that we're using in the environment that we may think that are probably very drastic, that they may work in the human host? Is there any way that we can make them less aggressive to be able to work there? The other thing, very important, is to consider cost versus timing, right? So you may have something that is going to be very costly, but it's not going to deliver very quickly. We also need to demonstrate the economic benefits of the prevention treatment that you're going to be using, and then perhaps focus that on the type of biofilm treatment and the outputs that you're going to get. One thing that it was mentioned in our table is that it's something that we heard yesterday in several tables, and is the fact that the community seems to be very happy with the way that NBIC is actually managing the funding calls, and the fact that we created an infrastructure already and a process that seems to be working very well. People were very happy with the feedback that they're getting. And one of the things that was mentioned is perhaps whether UKRI should be considering allocating more money to NBIC to do translation, right? So that would enable one thing that is also been brought up. We've heard in many occasions, we heard at our table, that perhaps we may be able to fund then either bigger projects or projects for a longer time. So that's something. Another thing as well is that perhaps NBIC should be considering partnering with charities to do joint funding. So that was something that was suggested at our table. And I think I've covered the health economics. I've already covered. So I think that's basically from our side.
Thanks, Miguel. So the next group will be Paulina, who's going to feedback on two groups. The one from this morning was number 4, and this afternoon was number 7. Yeah, when we touch this, it seems to be vibrating up the mic. So we're going to try and avoid doing that. Yeah.
I've got a lot to cover. No, I actually managed to, in my groups, there's been a bit of overlap, so I managed to group them, I think. One strong need that was expressed in one and the other group was the need for alternative prevention solutions to the ones that exist already. We had two different perspectives, one coming from marine sector and biofouling, where ships are covered with heavy metals, for example, as a preventative solution to build up. The other one was coming from agriculture, where chemicals are used. So they are not good for environment. We need different solutions. Miguel mentioned, for example, physical, mechanical intervention, something to work on too. And that comes with improving carbon footprint, the sustainability, and the effect on the environment we are having. Education was mentioned here quite a lot already. I won't cover that, but that was also a very strong point. Understanding the problem was mentioned. So the problem to the end user, what prevention would mean for them. Or, for example, to the end product, where do we need that prevention? But also, to what extent we need the prevention to happen, whether we are okay to live with biofilms to some extent, or whether we want to eradicate them completely. So we need to know when prevention is really needed. There is a need for more holistic approach to prevention that would cover, that would include researchers, industry, regulators, but also should cover interdisciplinarity. So we are talking here about researchers getting together, for example, with NHS. So starting the dialogue very early to know where the prevention is needed and what effects it could have, but also bringing, for example, the built environment there. So architects, which could account for when the prevention of biofilm would be needed when they are developing, for example, taps or walls or anything. Very strong need for data and what we do with the, so the data. And data would come, we are talking here about biofilm repositories, biobanking, ways we put as a community data together, where we store it, how we access it, who inputs there, who can use it. When we build this data around biofilm together with access to the data. Community can work better in developing solutions. Then together with the big data comes the need for data science and ways of analyzing and interrogating the data as well. There was a need. So one thing was to have the holistic approach, but the other way would be if you want some good solutions, we should provide space for more focused, more granular workshops and networks, so people from one sector could get together and work on the solutions for their sector. A lot about standards. Well, I think I covered everything. Thank you very much. Yeah.
Thank you. Paulina, thanks for those groups. So next up would be Susanna, who again had two groups. So from this morning, Mark's going to hand you number 7, and this afternoon, I think, number 7. You've been on the lucky table all. Oh, 6, is it? Oh, yeah, sorry, 6. Go ahead.
So from this morning, I think probably like everyone else, we spent some time talking about standards and regulations. One thing that came up was to make sure that you are speaking to regulators. If there are regulations in place related to products, make sure you're speaking to them right from the start of projects so that you don't get to the point where a solution you've developed is not going to get anywhere because there are regulations preventing that. We also spoke a bit about this had originated from COVID being very disruptive to lab work, and someone that had gotten into using a lot more modeling techniques, and whether that can be a way to kind of use it as like an exploratory tool to work out, test a lot of different methods quickly and see which ones might be a good route to go down. Something else that was quite practical was talking about, I guess, yeah, like testing things in real life situations where if you have, say, like, I guess, medical devices that are in the body, that if you do have a surface that is initially preventing biofilm formation, if then there's, I guess, like bodily fluids continually coating it, whether it can influence performance. I think something that Miguel touched on. And then, yeah, we also spent quite a lot of time talking about the barriers of translating research into industry. I don't think we came up with any kind of solutions for it, but kind of recognizing that it's a bit of an issue, and whether, yeah, there can be like specific funding for predictive assays or just kind of short-term projects. Like I think someone used the phrase like fail hard, fail fast, or something like that. And then this afternoon, kind of spoke about the need for potentially targeted prevention. So rather than preventing an entire biofilm forming, whether it's one particular organism that you can prevent from being there that will make a difference. We had discussion about that prevention is established behavior in the dental sector, and whether there's anything that we can learn from them. We had a lot of talk about education of various different communities, and let's talk about educating medics at an undergraduate level about biofilms, and nurses that are on the front line in hospitals, like preventing infections. And kind of an issue that prevention is, I think we praised it, prevention isn't sexy. People don't want to pay for something when the problem isn't already there. And how to, you know, what can we do about that? There's a lot of talk about interdisciplinary, like collaboration, whether I think it's a lot of the time focused around collaborating with, say, like biologists, chemists, physicists, whether there can be collaborations with like behavioral scientists to tackle it in a maybe slightly different framework than what already happens. And yeah, I think again, like a lot of other people seem to talking a lot about biofilm marketing, whether there can be a big campaign around, have a whole team working on it, and yeah, communicating to the public more about them. Yeah.
Thank you. Thank you very much. So I should say, Susanna and Pauline, who spoke just now, they're both our research and development managers, are particularly involved in developing investment and funding opportunities. So Susanna's based in Edinburgh, and Paulina is based around the southeast around Southampton. So a lot of common themes coming up. So I'm going to ask, the presenters still to come to genuinely just, raise new items. So I'm going to ask Katrina to come up next. She's got 2 groups to cover. Katrina is also one of our innovation team, who you'll know, many of you will know, works alongside Will, who spoke first.
Not many new items, I assure you. So just to show that we have done some work. Better techniques and methods to define the early stages of biofilm. So the words which came up were kind of gentler methods and kind of for the weak early stages of biofilms. Mathematical modeling wasn't mentioned. So improved mathematical models to capture surface interactions, continuum modeling there. Looking at surface treatments under debris or viable non-culturable bacteria, so kind of those which are hidden. That was my first group. Standardization, education, the kind of terminology, all of that was mentioned a lot. Translation as well, so that will come in the second group, so my table 4 in the second group. Non-toxic nature of the perhaps plant solutions. Industry awareness, so the industry who still do not know that they have biofilm, so for NBIC to go out and spread the word more. Again, definition of success came from the company, so 90% killed, or statistically significant versus what it really means to be successful in the real world. And again, the kind of best model versus the most reproducible model. I think that was, how Miguel said, how far do we actually go with making that, forwarding the research. Translation, so academia have better equipment than the industry. So how, again, bringing the real life into the labs. I think that's me. Thank you.
Thank you. So what we're going to do now, in the interest of time, we're going to move to the online group, and then I'm going to ask people who haven't presented, if there's anyone who feels things that have raised on their group, either this morning or this afternoon, that haven't been covered, to just sort of raise your hand and we'll come to the front. If that's okay with everyone, because I'm conscious of your diaries as much as anything. So we're going to go to the online group. Then I'm going to suggest we get Tom at the back to give his feedback. And we do then we'll do the short pitches. And then with time left, we'll have maybe a chance to people to speak from the floor to see if there's any things they wanted to raise that haven't been captured on the feedback yet on your tables. I did want to say what we will be doing is there will be a report coming out of this. So all this feedback that you've so beautifully produced for us, which we're really grateful, we will recycle this and send it back to you in a format and ask you for your feedback. And there will be opportunities to input again as well, because we want this to become something that genuinely describes what you see as the problems. Okay, so I'm going to ask, so over there is Jing, who's our project manager, and she's been carefully managing the online group. And we are actually going to bring someone in from that group, I believe, to feedback. Dario.
Perfect.
Dario, do introduce yourself.
Can you hear me?
Thumbs up.
Right. So good afternoon, everyone. I'm Dario. I'm a lecturer at the UCL School of Pharmacy. So within the online group, we had a very interesting discussion touching on both general as well as application-specific points, and many of these have already been covered in the previous talks. So we started by identifying a need for a better interfacing between research and regulatory standards and testing, which has been mentioned before, in order to facilitate translation of a broader range of innovative prevention strategies. So for example, we discussed the potential of using natural compounds such as phytochemicals in food packaging to prevent biofilms, but also mentioned that a lot of these compounds may not be recognized by the biocidal product regulations. In the context of the food industry specifically, we discussed about a technical challenge that affects significantly this sector, which is biofilm information within inaccessible or damaged surfaces within the food processing pipeline. So there is a challenge, but also an opportunity to develop new viable technologies to control biofilms on these specific surfaces. It has been mentioned before, but we also discussed about the need for models that recapitulate both the physics as well as the microbiology of the endpoint application of interventions more faithfully. And this is particularly important for complex systems. So for example, if one develops an intervention that needs to be used within the urinary system or a chronic wounds that present both significant physical and biological complexities. And for chronic wounds in particular, we also mentioned the fact that in vivo models also, in addition to in vitro models, are challenging and very difficult to establish. So if these models were available, we could potentially develop better prevention strategies, as well as also understand the mechanistic aspects of how infections develop. In the context of surfaces, we also identified some opportunities in developing innovative surface modification as an anti-fouling strategy. For example, surfaces which have properties that can be actively tuned, for instance, using external stimuli, or that mimic the characteristics of natural surfaces. And just in conclusion, purely from a research perspective, we agreed that there is still work to be done in order to fully understand how bacteria sense physical stimuli, mechanical stimuli, which may be flow, but could be also other type of therapeutic stimuli like ultrasound or light. And in order to use these stimuli as an effective prevention strategy. And of course, as I mentioned before, this goes kind of in line with developing better models in order to test these innovative interventions as well. So thank you.